Welcome to the topic Customer Relations in Pharmacy, Part 1. The objective is to be able to talk with customers pleasantly and efficiently at the dispensary counter and over the phone, how to deal with the most problem situations that arise, and decide when to turn the situation over to the appropriate person, like pharmacist. What attracts and keeps the customers? Service, which includes the staff courtesy and friendliness, and the price of products. What are the basic principles for good customer relations? The customer is always right, even when wrong. Listen to the customer. Never indicate you think he or she is wrong. Do not take it personal. Do not argue or contradict. Prompt, pleasant action on complaints saves most customers. What would be the method of communication? We can have written prescription, which is an order from the physician presented by the patient, or the verbal prescription on telephone by the physicians. What are the general considerations in receiving the prescriptions? Number 1, practice courtesy and friendliness at all the times in the pharmacy. Number 2, if the customer is unfriendly, consider the fact that he or she may be ill. Number 3, prompt the service is important to customers who are especially ill. There are 10 basic rules for the customer relations with the telephone techniques. Answer the phone promptly. Answer the phone pleasantly. And use the phrases directed by your employer. For example, good morning, this pharmacy, your name, and your title speaking. How can I help you? Talk clearly and be precise. Keep conversations brief and to the point. Lead the customer to give the required information as you want to receive it. Please avoid personal chats. If the call must be transferred, tell the customer about the transfer and what the reason is. Monitor the call, that is, check back to make sure that the person who should take the call has done so. Nothing is more annoying than being left hanging on the line. Any staff answering the phone should be made aware of the store hours, special events, sales, last delivery times, etc., since many calls are the questions regarding these matters always. If a caller asks you to speak to the pharmacist, the technician should ask, did you want to reorder a prescription? This will usually result in the customer giving the required information to the technician or assistant or any pharmacy staff members. If the caller still prefers to talk to pharmacist, the call should be transferred at once. The pharmacy technician may not legally accept the prescriptions from the physician. The technician should be able to end a conversation over the phone in a polite way. Suggestions for ending the conversations are, well, get the prescription ready for you. Thank you. Is there anything else? Will that be all? Can you excuse me? I have another call waiting. So this is handy when you have a caller that likes to ramble on. New prescriptions or the refills where the patient is waiting in store. And prescription where the patient is not waiting. And we do the deliveries except when close to the delivery pickup time. This is the priorities in filling the customer relationships, and we'll discuss that in the part 2.